spite of everything going on. In spite of everything going on, we're here today. We are providing this free webinar. I want to tell you guys, this is information for you to use, hopefully practically, that you can take back to work. That's the main goal. It's always been my goal with these webinars ever since we started back when the pandemic. Even before that, we've been working together to bring classes to your work site. So if you're interested in bringing a class in English or Spanish, please do let us know. We'd be more than happy to do it for you guys. Very important topic. Last year, Cal OSHA put into place the workplace violence prevention requirements for you to write a program. But the program, although it is focused on prevention, the regulation is not, well, Cal OSHA hasn't put out the regulation, is still in the works. So we're going by Senate Bill 553, and we are putting together a program. So since last year, we've been required to put them together. This year, we're required to do annual training and to ask workers how everything is actually going. How's everything improving the actual quality of work? How do we feel when we're at work, right? Because workplace violence is all about making sure that the perceptions, even the word perceive, is in the description or definition of what workplace violence is. And so a person may be interpreting something as workplace violence when the intent of the person committing the actual violence is not actually to hurt the person. So we went through those definitions when we started writing our programs and doing our trainings. This year, I started doing trainings again as a reminder and gathering information from the workers. And it's interesting how everybody has a different view on the topic because we're all human beings and we all have different opinions. Today, we want to make sure we cover three things because, like I said, I want to make it practical for everyone. That's always been my goal. And every time we do these webinars, we always start a little bit with the updates, what's new, what's in my mind. So before I get to the nitty gritty and giving you some good tools, I just want to review what's there. In the last portion of September, the end of September, we did see Cal OSHA issuing reminders to protect the workers against heat illness. If you do not have your heat illness prevention program in place, today is the day. Make sure that you include both exposure outdoors and indoor heat. We also want to make sure that we raise a flag for those that have field crews or people that are not in an enclosed space where the air is not being filtered and they may be exposed to either wildfires or unhealthy air. We did have an explosion at 9:30 p.m. last night in El Segundo, and the quality of air may be affected around those surrounding areas. So take a look at that as well. So I like this, what's new, because it kind of highlights some of the latest. Also with emergency response, the bird flu, respirable crystal silica, emergency temporary standard on it. We talked about it. We have a full free webinar that you can look through the archives and all of our recorded sessions. All right, so this is kind of like the news, what's up, what's the newest and latest. And moving on to what's on my mind, I did send you guys all a monthly newsletter. I make sure we do a one page so that you have time to read it. It is easy to read. The reason why I wrote this newsletter this month was because I saw a couple of issues at several of my clients where the issue could have been resolved with repetition. Today, when we talk about mental health, we will see how practicing and repetition of processes, work instructions, the daily things that workers do, if we repeat the steps, if we ingrain it in how we do work every day, it just becomes easier and less stressful. Making it simpler for workers really matters because that lowers immediately the level of what should I do? What does my supervisor need me to do? Why is he giving me all of this last minute? The repetition of training regarding safety steps and work instructions that include safety in it, it's crucial. And it does contribute to mental health, although that was not what I was thinking about when I wrote this newsletter. And if you want the rest of the newsletter, this is just a screenshot of half of it. But I did give you a supervisor's checklist at the bottom, so you can get a copy of it. It's one page. I want to make sure you guys get information every month that is practical. And I think this one is a good one. Picking one every month. I got my inspiration from one of my clients who he's so proactive. He was talking to me about the monthly, he calls it technical monthly meeting. And they go over one procedure every month, and everybody kind of go over what are we skipping, what are we not doing, tweaking and providing input. So let's kind of bring it together with how this works with mental health. Remember, I come from the Cal OSHA, from the safety and the standards point of view. So in celebration of October 10th, mental health, the World Mental Health Day, we want to make sure that we highlight some of the practical things that will help you today to do something and improve the quality of life while your people are at work, right? So remember, it is 11:10 and my English starts acting up. If you don't understand something, my pronunciation sometimes is funny. Just let me know. I'll clarify it. But here are my learning objectives today. One of the first things that I was thinking when I put together this webinar is like, how do we know when we need to act? How do we know that there's issues at the workplace where people may not be happy while at work? Because that's what we want. Remember, we are spending so many hours of our life at work. It is said that it's an average of 90,000 hours of work in a lifetime, in a person's lifetime. That's a lot of time. So we want to do it joyfully. We want to do it purposefully. We want to do it where people feel they're putting out all of this good energy by giving this service or work, and that they're happy with it, and that the environment that we create is a good environment, and that it's all part of that safety culture that the Injury and Illness Prevention Program requires you to put in place. So I want to give you just some practical flags, red flags, when to raise that red flag so that you spot when you need to act. And so just a quick screening checklist to identify those work-related risk factors, early warning signs. And mind you, the Workplace Violence Prevention Program allows for you to write down some of those things really clearly as to, early warning signs for type 1, type 2, type 3, type 4 type of workplace violence. So use those things that you've already put in place to know and to spot when to act. Today is going to be a quick overview, right? Remember, deciding the next steps within safety procedures is important, but this is not you as a supervisor, you as a safety director, you as the person in charge of putting together these programs and to guide and bring the safety culture to a point where it is good. It's not about medical casework. So today, I'm not here to discuss, mental health issues under the lens of medical casework. That's not what we're doing here. We're here to discuss mental health as an issue that is there, and how can we make it practical? What can we do today without getting in trouble with our human resources department, but just kind of give me something practical, right? So spotting when to act is one of my main to-dos. How do I know I need to do something? Number 2 is applying practical control. So I'll give you 3 ways. One is the expensive one. The other one is the not super expensive one. And then the last one is a quick, we can start today. If you do it carefully, we'll do it good. And 3, applying some requirements, remembering that today's topic will very much help you build and update your injury and illness prevention program and your work violence prevention program. There's elements that are required within those programs, and this class today will allow you to address some of these issues of stress, fatigue, violence risk as safety hazards, plus the records to prove it. All right, awesome. I see some comments, and remember, you can start putting things in your chat. I want you to right now in the chat or raise your hand or maybe Veronica, if you want to do a little bit of taking a poll. The question would be, how many of you, and I'll keep going, I'll keep talking, and then Veronica will see how many of you answer. How many of you in your organizations know that you're already doing something for mental health? Either you have a specific program or an employee assistance program, or you're actually addressing this work-related hazards that relate to safety behaviors in some way or another. So how many of you are currently proactively doing something for mental health at your organizations? Okay, that's the question. I'm going to see how many of you say I have. Okay, 2 people have raised your hand. Remember, we have 65 people on this webinar today, and we've got 4 people raising their hands saying, yes, I do have something proactively being done in my organization for mental health. I don't see any more hands being raised. Veronica will give me the ultimate count, if you will, please, Veronica, so that we know how many of us, and it's 65 of us, how many of us are actually doing something right now proactive in regards to mental health. All right, so we'll see. Okay, this is so funny. I see people, maybe yes, I'm going to say yes, but no, you know what? And they just go for the not sure, not so sure. Okay, this is good. These are good numbers, actually. 75% of the people on this call are saying that they do have something related to mental health. This is fantastic. This is great. For those of you that are not sure or are answering no, today is the day. I'm going to give you 3 practical ways of doing this, and you can choose which one to do and get started. Get started, because I'm going to give you some interesting statistics. Just highlighting this for those of you that are here because you know that there's some issues going at the workplace, or you've been getting some reports of people not doing well. Remember, if they need help, they can call or text 988, which is the 24/7 U.S. Suicide and Crisis Lifeline. So that's important. It's good to just start right there. We're trying to bring awareness to this issue so that people know that they're not alone, that this happens to most of us, and that we want them to get help. So we're addressing these things within the IIPP and the workplace violence prevention requirements. Remember, supervisors, people on this call, because we are not mental health experts. What do we want to do? What is our job? Your job as a supervisor is to focus on work impact and controls, sort of seeing it like, I need to identify the hazard, and then what controls can I put in place? So keep that in mind. That's the whole mindset today. You do not diagnose, you do not manage medical cases, right? We leave these issues to our human resources and medical privacy, accommodation type of issues. We let them handle that separately per your employer policy. Okay, very good. OSHA does address workplace mental health. They have this handout, and let me see if I can get you the link for you to actually read it with your company and your employees later on. We'll get all of these links, and the presentation will be sent to you at the end of this webinar. Here are the very sobering statistics, you guys. Nearly 1 in 5 United States adults live with a mental illness. Those are some strong numbers. Workplace stress has been reported to cause 120,000 deaths in the United States each year. This is why it's so important, because we're saying that workplace stress is reported to cause deaths in the United States. Okay, this is something important that we need to get a hold of. If people are happy while they're at work, productivity soars. If the morale is good, your company will do fine, even in hard times, right? Because people are happy to be there, they believe in what they're doing, etc. So this is an important topic. Remember, 65% of US workers surveyed have characterized work as being a very significant source of stress each year. And this has been a constant issue from 2019 to 2021. Statistics say that 65% of US workers say work is the main source of stress for me. 83% of United States workers suffer from work-related stress. If you're thinking, what do you mean? How do you get that? Well, we get ill. Stress causes you to get sick. 54% of workers report that work stress affects their home life. And remember, many of you on this call, many of you who are leading your organizations and your companies, you're the owner, the safety director, many of you know that you're getting work compensation stress claims on your desks. And this is a good statistic. For every $1 you spend on ordinary mental health concerns, such as the ones I'm going to talk about today, employers will see a $4 return in productivity gains. That's awesome. Now, some CDC statistics. So they're different from the OSHA statistics because the CDC focuses on public health, right? So it's a bigger pool. The 2021 suicide rate among US persons of working age is approximately 33% higher than it was 2 decades ago. Whether you want to delve into the reasons why that has changed, that's up to you, but the numbers are there. More than 49,000 in 2023, one every 11 minutes, one suicide death every 11 minutes. That's a lot. That's a lot. Among the top causes of death for ages 10 to 64, my gosh, to me, when I read this, my heart hurt. I feel it. Many of you who have children, when you see the number 10, a 10-year-old committing suicide, that's awful. And it's also the number 2 cause of death for ages 10 to 34. Amazing. I'm just kind of stopping for you to kind of really take in these numbers. Certain industries show higher risk. Construction, wow. Agriculture, mining, arts and entertainment, and repair trades. The construction industry, so the actual Center for Research and Worker Health. Let me take that back. The CPWR is the Center for Research and Worker. I forgot what the CPWR stands for, but if you go to CPWR construction site, this will show up. Mental health, because of what we said about the Centers for Disease Control statistics, we also have the mental health, the construction industry stats on their page. And it's very, very sobering as well. They have higher rates of injuries, fatalities. We have the Focus 4, right? The Focus 4 in construction relate to falls, electrocutions, struck by, and caught between. Well, we also have a high rate of suicide. For example, although construction workers are only about 7% of the entire workforce in the United States, they were 20% of on-the-job fatalities and 16% of opioid overdoses. You can see the chart on the right that shows that in 2023, there was 982 fatal injuries among construction workers and 15,910 fatal overdoses and 5,095 suicides. So the CPWR has a lot of great resources and practical tools, infographics, and bilingual toolbox talks to start hitting these mental health issues for construction workers. Let me see, let me review the chat while you guys look at what's on my screen. Yes, it is. It is really great to see that many of the people in our call today have a program set in place at their work site. So this is great. And I hope that today you'll get some extra tools to supplement what you already have in place. So the CPWR also has a handout with the crisis text line and the National Suicide Prevention Lifeline. So you should print this out and use them as part of your tailgate meetings, etc. Cal-OSHA regulations. So OSHA, the actual site here on your screen is from OSHA, so federal OSHA. And right now they have this big sign that, you know, they're not updating the site. Nevertheless, for workplace stress, everything is pretty much updated. But in Cal-OSHA, you also have, where's my Cal-OSHA? You have a full page in Cal-OSHA regulation that relates to, you know, mental health issues. And I'll show it in a moment. Okay, let's get to our objectives. When to act, we want to have a quick screening tool, right? Remember, supervisors, safety directors, we do not need to diagnose anything. I know we're talking about mental health, but you're not a mental health expert. You're watching for work problems that raise safety risks. So that's super important. I'm watching for anything in the workplace, at the workstations, at the field installations, at the machine shop while they are working. I'm looking at each post. I'm looking at each work task and seeing if any of these work problems raise some of the safety risks. If you see enough of those problems, you take that seriously and you take action now. You don't need to wait until, for those of you that don't have a program, you don't need to wait until something is in place or a new policy comes out, etc. These things can come up and become red flags to you, and so you take them as cues. So it could be a work impact cue, like repeated errors. So you see that this station is having repeated errors, and maybe it's just this one shift, and it could be most commonly your graveyard shift, because it's difficult, especially if you have newer workers during the graveyard shift, that they are adapting, their body's adapting to those hours because of the circadian rhythms are not there yet. They're still used to being asleep at that time, so errors may be high. Repeater errors, near misses. People need time off work, but sometimes when it is done the right way, they're scheduled. Oh, I'm sorry, this is near misses. This is also relating to errors at the work site. Missteps. So I was talking about my newsletter. My monthly newsletter talked about, those technical SOPs, standard operating procedures, or work instructions, however you want to call them, but you have steps in which you've delineated how to do a task. And then all of a sudden you find workers are missing steps and there's some errors, or, there's conflict that is just happening at that particular post or task, or all of a sudden you're having people that don't show up. And that's what I wanted to talk about. Sometimes people schedule, time off, and they say, next week I need Monday off or whatever. But what if they just simply don't show up? It's something that is happening at a certain department. That you should take that as an work impact cue. It's impacting the work. It's impacting the overall morale. Why? Because when someone misses work, the other guy has to, take now double the work, and he's stressed out, he's fatigued, or he or she. So visible fatigue or safety critical posts where you can see that people are showing feelings of being overwhelmed and more errors, etc. Context cues, maybe issues of peak workload windows, or when you have tasks where people have to do solo public facing posts, or night extended shifts, high focus tasks, all of these things that need to be done in a way that people are focused. They need to be focused, but it's not happening. That should be your cue as well. And so now you got to make a decision, right? How do we do this? You got to check in now when some of these cues that are impacting the work of people are showing up, and some of these cues in the context of this job, it's important to be really focused, because this kind of job, you're going to be there, and it's a high focus type of task. You got to make a decision. If these things are showing up where it's impacting the work, where it's impacting how many workers you have versus the ones that are missing, etc., bring in your checks and controls. And then if it's an issue of workplace violence, make sure that you do appropriate response per your policy. You log it in your actual required log, and you refer it beyond supervisor scope via your own policy channels, could be your human resources, etc. So I wanted to give you just kind of like this quick screening, right? Red flags is what's happening out there safety-wise, such as repeated errors, near misses, missteps, a cue. And some of you may ask, well, wait a minute, but how many of these should bring that red flag? It all depends what kind of work site you have, but I'll give you more tools. Here we go. You could do a sample one-liner to paste into your IIPP, but remember, anything that you write down as part of your policy becomes your rule, and then you can be cited later on if you didn't make it happen. So I'd rather make this something that you start testing out there, and then as it becomes part of your culture, you can implement it into your policy in writing, right? So supervisors initiate a work-focused check-in and implement feasible controls. Work-focused check-in, check what's happening out there, and then implement controls to reel everybody back. to a safety and well-being standpoint, right? So if a safety critical cue occurs, like the ones I told you, near misses, people are not showing up, people are overwhelmed, etc., or if two or more work impact cues are observed within that same shift or in a rolling 14-day period, and you have to make your decision, right? It could be two errors in the same shift for a critical task, or maybe that's not a critical task, such as unjamming a machine that jams often because of the design. You're trying to get a better design, you're talking to headquarters, whatever. But in the meantime, you're having a machine jam up, and then you realize when you review the procedures, the lockout tagout procedures while they're unjamming it, that workers are missing some steps. They're not really doing the checks that they need to. They're not informing everyone around them. And some of the, maybe temporary workers who are around, they don't know what's going on. They may be tempted to unjam or restart the machine. Whatever it is, that's a kind of like a safety critical type of task. If errors occur within the same shift, I will raise this flag and implement controls right away. I wouldn't wait for that rolling 14-day period. But you can do that for tasks that are less critical. And then attendance and injury patterns, maybe you want to assess them over 30 days and raise the flag over what you observe in a month, right? Actions, follow-ups, you document them, always document, and make sure you start integrating these assessments and check-ins into your IIPP and your workplace violence program. So if you see something, one of these cues, for example, an impact cue, two scheduled absences in 14 days and two near misses in 7 days, you implement controls. For example, you say, I see that people are not showing up. Maybe this is one of those tasks where they feel overwhelmed and they rather not deal with it. And so that's why you're seeing that high number of errors or people not showing up. So maybe you want to do rotation or breaks, mini breaks, or you want to do buddy systems or change your procedure. Just take a look at what's happening, right? And this is all within your possibilities right now. Looking into what are you seeing? What are the cues? Are people, being overwhelmed at work? They're making mistakes. That's how you know most of the time mistakes are showing up in the same shift, or there's some near misses where there could have been property damage or injury, or maybe no near misses, but you're having a lot of first aid issues logged in your first aid log, and you're maybe in this particular machine, this is happening too often. What's going on? And then, so you need to change. So what did you see? Document what you saw. What are you going to change? And get creative. You could start rotating workers sooner than every 2 hours, because I know that every 2 hours is kind of like the rule for everyone, but maybe sooner than that. And then recheck, right? Specific date and time. I'm going to recheck if my control, what I changed, this new rotation schedule, instead of rotating them every 2 hours, I'm rotating them every 45 minutes. Let's see if that made a difference. And then in your next Wednesday tailgate, you're like, oh, yeah, we had less errors over the whole week that we implemented that new rotation schedule, right? And then you tie it into your documents. It could be your IIPP hazard documentation, because you have scheduled inspections, for example, to take place for your IIPP. Or if it's an issue of workplace violence, you tie it into what kind of threat, aggression, whatever it is, and you need to log in your incident log. Okay, very cool. So I hope this is practical. I hope I'm giving you something that is practical and relates to mental health, because once we do these things, people feel like, hey, you're paying attention. You're actually trying to see what I do at work so that you can help me tweak it so that it's less stressful, so I don't feel overwhelmed. Hey, I want to show up to work. This is the kind of stuff that you can do now, right? 2-line supervisor script. Okay, yeah, you say things like, I've seen 2 near misses at the counter after 4 p.m. I see that you're rushing your entries in the log. I want to make sure you have what you need to work safely. My goodness, these words come out of your mouth and people are like, whatever you're eating, keep eating it, right? I don't know what changed here, but this is good. People feel that you care, oh, yeah, I'm too rushed. Action. Let's adjust coverage. Let's see if breaks today, how we planned it, will work better. And you document the change. We'll review it again next shift. Oh, man, this is doing something, right? And documenting your records, you always have to find hazards for your internal illness prevention program. You're required to find hazards and then act upon it, meaning abatement. This is all part of the wording in 3203, California Title 8, 3203, Section 3203. And then route those medical issues or medical leave issues and questions to human resources as soon as you can. Because sometimes employees, when you go up to them and you tell them, rushed entries, I know that this is not happening, there's been near misses, whatever you tell them, sometimes they will take it as an opportunity to pour and say, oh my goodness, well, you have no idea what I've been going through. And, now I'm on this medication. And then they start pouring their heart out to you, which dwells into those issues of privacy concern issues. And you do want to route them appropriately. 3, low cost control. So let's go over some things that you can do today. So we're going to fix stress hotspots with cheap, fast moves today. This is what I want to bring you today. We don't need this long, I got to get approval and I got to get this budget to plug it right into your internal illness prevention and your workplace violence prevention programs. What you want to look into today is, can we get into issues of discussion of intact teams, communication amongst teams, working as a team, team civility norms. I like that. All of that is for, or in order to get our people to have fun while working together. And when I say have fun, some people will criticize me for that. We're not here to have fun. We're here to work. Well, like I said, 90,000 hours, right? I will be happier and I'll do a better job if I feel what I'm doing is fun, or if it's not fun, at least that I have a lot of personal satisfaction because of the work I'm doing. So team civility norms have a lot to do with how we treat each other at work and how we treat the public and how the public treats us. And if managers and organizations are allowing certain behaviors from the public towards us that we do not consider civil, there is some things there that we should tweak and change. So that's number 1. The talk about team civility starts with those 5 to 10 minute tailgates about what civility means, right? And so you could start saying, guys, we've seen a lot that during the tailgate meetings when we all gather around for our Monday powwow, I am talking to you guys and then 2 or 3 of you are on your phone. Being on your phone while I am talking is not considered very civil. And so that's what we are talking about when we want to build our team. We're going to define and give our teams very clear pictures of what is allowed and not allowed, or what is considered civil and not civil, better said. That way they can easily say, okay, I understand. How can we work towards not doing A, B, C, and those 3 behaviors, right? And you bring your little whiteboard and say, okay, these are the 3 behaviors, and maybe you don't list the 10 behaviors that are happening. For example, people may be talking when you are doing the tailgate, the safety tailgate, and you notice that there's a lot of joking around and not taking it seriously. Okay, just one behavior at a time. If you pick one behavior at a time, that's much better than throwing a list of 20 behaviors that you are so tired of dealing with, right? But that that one behavior will help everyone improve it, and just make sure it's measurable. Make sure that people don't give you this kind of pie in the sky wording where they go, oh, well, it's let's all be nice. Well, what does that mean? Let's work with one of these team civility norms, behaviors that are occurring, taking place, and we don't want anymore, and let's make it work for everyone. How will that look like? And so for that, we have the video that will guide you even better, because I got some tools for you. In a moment, we'll play it if we have time. Otherwise, I'll just send you the links, because these are fabulous videos. Okay, the number 2 thing, cheap, fast moves, recovery breaks, and rotation. How easy is that? And I know it sounds like, well, you're going to mess up my entire logistics and how we do work. Remember what I said, I don't want you to do recovery breaks for every single station or work task. I want you to take a look at those near misses. I want you to take a look at those issues where people are complaining, supervisors, your leads. Your leads many times come to you and say, you know what, I don't know how to get these guys to do this. Let's say you're having a lot of slip, trips, and falls, and it's because there's a lot of debris always around the machinery and equipment, and you can't get them to just get the broom and sweep. And so when you're getting these kinds of things, it may be because the guys are doing assembly as well, and or working with a machine that requires a lot of repetitive, and their hands are hurting. And now on top of that, they have to, sweep. And that's also something that aggravates their symptoms if there's wrist pain, for example. All of that, those are flags that, okay, let's do recovery breaks and rotation. Right now, today, I know everybody has mandated breaks every 2 hours, but I'm not going to wait for that because we're trying to improve mental health, right? We're trying to make sure that people feel taken care of. So what about those 2 to 3 minute micro breaks each hour during peaks, right? Tiny 2 3 minute breaks reset people. It's like, oh, that was cool. Rotating for hardest pose so that there's no more mistakes piling up. And number 3, another one of those cheap, fast moves you can do today to improve mental health at the workplace: role clarity and job control. This one is huge, and it ties directly into my monthly newsletter. If you guys did not receive it, please make sure you tell me after today that you want to receive it. It's always one page. It's a quick tip, something that I've seen either because I'm visiting work sites and just comes to mind. This applies to everyone. And that role clarity and job control is so important because many times we're going, we need to produce. There's this whole demand. We got all of these requests either from management or to produce this much for this week and this different parts or this different kinds of products. And we're throwing all of these things at our crews, and they get stressed just by hearing you. So determining top priorities, and 5 is a little too much, but if you can have like 3 top priorities for the week and say, okay, guys, let's focus on these 3 things this week. It makes it clear for them what the goal is for that week. And then if you can give them a choice on how to achieve that, let's say they have 2 or 3 methods on how to get that done. Don't dictate, don't be the dictator and say, well, I don't care. These are the top 3 priorities for the week. This is how we're going to get to our goal of producing 3,000 widgets under this request or for this request this week. And we're going to do it this way versus these are our priorities for the week. And I would like to hear your input as to the best method to achieve this. I know some of you guys like to do it utilizing, the lathes over here, or some of you really like the new robot that we brought in. What is it that the options are? People can talk back, give input. That brings up the morale. Everybody feels happier while at work because they feel like you care. You're not just imposing how to get the work done. So here is the link for one of the actual resources, which I think is really good because remember I said I want to, once you leave today's webinar, I want you to walk out of here today thinking, okay, so she talked about 3 different things. One of those is really getting into how are we working together. It's very rare that people work alone, right? And even when they work alone because they service either your clients and you're sending them out there in the field, or you have cubicles or whatever it is, they still have to relate back to a supervisor. They're still in constant communication over the phone, etc. There has to be that good morale. There has to be that good support and connection amongst teams, right? And so I really love this On the Agenda workshop series. And the link, I'm going to put the link to, there's all these free presentations that they actually have for you guys. There it is. Mind you, this is from Canada. Canada has a different way of handling safety than the way we do it. Canada does it in a way where federally they will give you some guidance, but in each province has their own body of or regulatory agency, okay? But they have a very strong workplace strategy for mental health type of resource library, and I love it. I love it. So this one talks about agreeing on 3 to 5 norms in a 10-minute huddle. That's easy. That's easy to do. That will start you on the right track. Documenting either the tailgate with your sign in and the norms list, meaning what is it that you are aiming to achieve after you got together with them. You did a 10-minute huddle and you talk about civility and how to build your team. And then measuring. So you take in that huddle that you did, that tailgate, with your crews that sign in and we're supposed to pay attention for 10 minutes, and then you take it 30 days out and see how did this work? Did this allow for some improvements? Are people really moving towards changing this particular psychosocial factor that we feel is important to change as a way to improve mental health? And you adjust norms if needed. Okay, and again, when you talk about all of these things, there's sometimes someone bound to come after the meeting and say, hey, I've noticed it's good that you talked about this is what's happening. When you bring the awareness, when you talk about these issues, people privately will reach out to you, supervisors will reach out to human resources, take care of them. And if someone needs help, route them through. Some of you have chaplain services where they can talk to someone who, especially if there's some issue of needing spiritual guidance that they have verbalized to you. Okay, chaplaincy works. Maybe it has nothing to do with that, but they want some help because they're going through a lot in their work and personal life, and they're having some issues with domestic violence, and they came to you to talk about it. Okay, then go ahead and route them through your employee assistance program. You know, a lot of these employee assistance program will take care of the whole family, and calls from a wife and a husband and boyfriends and girlfriends, all of that in order to help them and route them to improve the health of that worker, because it's their support system, right, that they also need to be okay with. Okay, so here is the video. Let's play just a little bit of it, please, Veronica, because we don't have too much time. This is the Canadian one, and then I'm going to give you one for what the NIOSH, the Centers for Disease Control, have put out there for us. So a few minutes of this.
Okay. Would you like me to start it at the beginning?
Yes, please.
Okay. Are you able to see it? Are you able to see it, Alma?
Yes, perfect.
Okay.
Thank you. I'm sorry.
Are you able to hear it?
No,
No?
no.
Okay, give me 1 second. I think there's something, I mean, if you want to continue, I don't know, for some reason it's not letting me share sound.
Okay, not a
Not sure
problem.
why.
So between the link that I gave you and this video, you will have a good idea on how to go about starting to build your teams. So in the link, let's take it to the link again. Let me show you. In the link I gave you, you will have access to resources such as this one. I'm going to show you this one. This is one directly from that Canadian site. Let me see. I'm showing you guys that presentations. I love it. Putting balance. So balance is one of the psychosocial elements that was picked for this particular presentation. I picked balance. And maybe the word balance came up in one of your tailgates where people feel that work is not allowing them to balance work and their personal life. They feel that when they go home, they actually bring work home. And they're stressed out, and the quality of life that they're having at this point is not balanced. If that's a common theme, okay, you bring it up. And I loved finding resources so you don't have to, spend all this time putting together resources that work. I love this one. Look at this slideshow that they have. Hold on so that I can show you it. So remember, the actual PowerPoint that I'm showing is from the Workplace Strategies for Mental Health Canada Life, and it's just picking that balance. But there's a list of different terms. Let's say it would be another psychosocial issue of respect. If it's respect that you feel is a common theme, that people are very disrespectful, the crews are actually all the time showing disrespect to one another, a lot of conflict amongst crews out there. Whatever the issue is, you pick that word and then there's a presentation for it, and I love it. So they have a list of what kind of psychosocial factors they've already put resources for. And in this case, balance, creating awareness. And so the way this one goes is process, review psychologically safe discussions, define balance, recognize what it looks like, list words that embody positive balance, choose actions that demonstrate balance, look at criteria for making meaningful change, and recommend action. I really love this. So say this, focus on moving forward. I love this because this allows, hey guys, so we're going to have this, our next meeting is going to be all about balance. That's the common theme that we're trying to focus here because everybody's feeling really overwhelmed. So let's not discuss all the past and say, oh, last month you threw all these projects at me and blah, blah, blah. And now it becomes a not very pleasant meeting where everybody's throwing at you all of the past stuff. Let's focus on moving forward. So this is what we're trying to fix right now. This is why we're having this safe discussion about balance, because it's a common theme. We're trying to improve mental health at the workplace. Offer constructive suggestions for improvement. Discuss ideas, not individuals. Don't say, well, so-and-so, my boss, not individuals, just the idea. And so you go back, if people start saying, well, my boss did this to me, and I remember when he gave me and assigned me this project, you kindly stop that person. The leader needs to, take a look at this and say, okay, I understand. Remember, we have some rules for this meeting. We're not discussing individuals. We're talking about the idea of why balance is not there. And we're going to have everyone, we're going to give everyone the chance to contribute. And we don't want to be pointing fingers at anybody. So it becomes a safe space. What is positive balance, right? And how are we supporting our workers to manage the demands of work, family, and personal life? And then things that they can either acknowledge or say, no, we're not having any of this. My employer encourages me to take my entitled breaks. How is that happening? And then you start asking for ideas. And maybe someone will say, no, my employer, maybe in your department it's happening, but in my department it's not happening because every time I feel like taking a break, something else gets thrown at me on the same day or during my shift. I am able to reasonably balance the demands of work and personal life, right? So these are things that you will put up there and people will react to it. And then you can move on to, okay, if this is not happening, how can we make it happen? And so as you can see, the presentation is very good. And it goes into, I don't feel burnt out in my job. And everybody's going to say, no, this is why we're discussing this because we all are feeling burnt out, right? And then we start saying, okay, fine. We went through all of those statements that start the discussion. Now, what words embody balance at work? And then you get into flexibility, communication, thoughtfulness, kindness, empathy. How does that look like? And then what actions demonstrate the words you choose? So if you chose thoughtfulness, don't make it pie in the sky. Now you have to make a list of what actions demonstrate thoughtfulness. I love it. I love it. And I'm not doing it justice. You have to really go into their site. Like I gave you the actual link and you will find all these resources. Make sure you watch the video first. Okay, now I'm going to share with you back to my own PowerPoint. So that's one resource that I found very helpful. And then going back to my PowerPoint, the United States does have an equivalent to it, which is the Centers for Disease Control and NIOSH Total Worker Health Webinar Series, introducing the NIOSH Worker Wellbeing Questionnaire. And this has been there for us to use since 2021. Maybe some of you are already using it. This is perfect for those of you that have the budget to quantify the actual well-being of your workers. It is a questionnaire that needs to be administered to workers, and they need to be well aware of the meaning of this questionnaire because it does delve into a lot of those questions where workers may not want to give you a truthful answer, right? Such as how much stress is put on them, how overworked, overwhelmed they feel. And so if they feel that you're just going to be pointing fingers at them, they're not going to answer. So there's a lot of work that needs to take place prior to administering this work well-being questionnaire. Okay, so take a look at the video that they have. Let me give you the link as well for that one. It's a great video where she is explaining it and she talks about why this is a great tool. Okay. Oh, let me copy that link. And now, oops, it might start making noise. Hold on. Da, 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 da. I wanted to make noise. Yeah, it's gonna make noise. Okay, so we'll close it up. I am putting it on the chat. That one is NIOSH. For those of you that have the budget, that have the time, and are already looking into improving your mental health at the workplace, this is a great tool. I don't know, I would like some input from all of you to see if you guys are already using this NIOSH questionnaire. If some of you are, please raise your hand. I'm interested in knowing who is already using it. Okay, so see, I told you I was going to give you some good tools to take back and make sure that you got some to-dos. By the way, in the questionnaire that we send you after today's presentation, one of the questions is whether or not you got something that you will implement and make it practical and it will help your work site. Please let us know. Please, that's important for us in order to continue to get funding for this webinars and the work we're doing. Okay, so we talked about that. What else did we say? The control number 2 role, I talked about that. Make it simpler, tell them what they need to do so it reduces their stress. And objective number 3 of today's class is making sure that you tie it back in with your compliant documents, such as your IIPP. The IIPP requires that you do hazard identification. And many times we're focused on just identifying very physical issues such as trip hazards, use of ladders, electrical hazards. I invite you to also identify those hazards that have to do with issues of mental health, such as, you know, the way you are assigning workloads, the way you see conflict takes place. There's a lot of conflict in certain jobs, tasks, or posts, or if there's a lot of fatigue in certain jobs. All of those are hazards because fatigue, conflict, all of that, high scheduling, cramming up the workload always leads to more errors, and more errors, more mistakes lead to near misses lead to injuries and property damage. So as an example checklist here, for example, is this a late shift fatigue type of job? Yes or no? If yes, do you have a rotation or micro break plan posted? A control, always a control. Remember, IIPP requires you find a hazard, you fix it. Training and communication within the IIPP. Make sure you do your tailgates. And maybe if you're not in construction where you're required to do tailgates every 10 working days, you're thinking, I don't need to do this. Well, I have news for you. Training and communication for everyone else, even outside of construction, you have a requirement to train people. And so basic de-escalation techniques may be part of that, you know, because we found these hazards maybe de-escalating. If you deal with public, for example, you're dealing with public all the time. Sometimes you feel threatened, people mistreat you. So that's the public towards the worker, which we said is type 2 workplace violence, right? Basic de-escalation techniques, and make sure that you drive it home, that you actually give them tools on how to do basic de-escalation. If you're in healthcare, that's another requirement. Remember, in healthcare, for example, for skilled nursing facilities, you have the requirement to actually have de-escalation training where it's formal and you step by step how to deal with violent behavior from people within your skilled nursing home, that kind of thing. Explaining the rules, make sure that you tell them what does it mean to have these new rotation things, what is civility norms to build your team, etc. So make sure that you document everything you're doing because these are part of your efforts to improve your injury and illness prevention program and the safety culture. This is true improvement of your safety culture. And whenever you are investigating a near miss or incidents, make sure that you add that checkbox to your forms where you put there, this near miss or this incident was due to an issue of mental health. And you can put there scheduling, role, conflict, workloads, etc. Add corrective actions to your incident investigation documentation and keep your records current. All right, so remember for the workplace violence, that's a different regulation. This plan requires that you have a person who's responsible for your plan. It requires that you have hazard identification. It requires that you have response steps, etc. Review your current policy. If you don't have one in place, call us. We can put it together for you. But make sure that in your post-incident steps, you are integrating the mental health issue that we're talking about today, such as caring for the worker, counseling, updating your controls, whatever that means. If it's, changing your layout or increasing the amount of staff that you have on that post, etc. That's what Cal OSHA wants to see. And this is why there's no per se mental health standard. It's worked into your injury illness prevention program and your workplace violence requirement from June 2024. All right, the control you implement after you document there's a hazard that you found, and then you implement the controls such as breaks or changing the layout or buddy systems. Document it, because that is proof that you are being CalOSHA compliant, and it wraps up everything very nicely. It puts together this issue of mental health and improving mental health in the workplace today, while also becoming compliant with CalOSHA regulations. Okay, so this is my recap. This week, make sure you add that IIPP hazard language, such as logging fatigue, escalation, or any other factors on inspections. And on your inspection record, that's where you want to make sure that you're identifying mental health as part of those hazards and the issues that I discussed and I talked about, such as those work impact cues, right? So this week, you can start with those things. Maybe this month, you run 2 tailgate meetings where you discuss some of these tasks that have high complaints about fatigue, or maybe those late night shifts that are causing these issues where people are making mistakes, etc. So maybe this month running, and I'm not going to say 2 tailgates. I'm happy with 1. In this quarter, complete that workplace violence annual review. Call us if you want us to do it for you, and make sure you have 2 or 3 corrective actions from whatever your workers have given you input. It is 12 o'clock, and I'm going to close up with the following. Humor, it's a very important part of our lives. Laughing and making people have fun is also very important. I have a couple of clients that are good at this, in the sense that they know how to keep it professional. I have a link for you guys, just like I give you a link to the NIOSH CDC and to the Canadian Life website with all the resources that you can use to improve mental health at the workplace. There's also a TED Talk, short 10-minute video from Andrew. What's his last name? I forgot his last name. But I will put it in your email with the presentation and all the resources. Watch it. Watch that TED Talk. He talks about putting or injecting humor into our daily work lives in a professional way, making sure that the subject that we are trying to be funny about is an appropriate subject, and keeping it professional, so by not targeting anyone. So we don't make fun of anyone. We don't use coworkers or supervisors or individuals as a way to make fun or to have fun while at work. And also the timing to make light of things and have fun. Timing is very important. So he talks about those 3 things. But I think that humor should be part of how you deal with mental health, right? If we have fun, if we laugh, we will have a much better day, no matter if it's at home or at work. Thank you so much, all of you. I hope you had a good time with me today. I sure did. I love doing this. Thank you. Thank you, all of you. Thank you, Veronica. And we will be sending that TED Talk video and the rest of the resources.
Thank you so much, Alba, and thank you everybody for participating today. And we'll stay a couple minutes in case anybody has any questions.